Hi, I'm Dr. Devayani Barve. I'm a plastic surgeon and I practice in Mumbai. Today I'm going to be talking to you about a common procedure which all my patients are curious about. So tummy tuck is our talk for today. What is a tummy tuck exactly? As the name suggests, it's tucking the tummy which is in excess or which is loose or which is showing up as a paunch in all your pictures and your best clothes. The technical term for it is an abdominoplasty. Now this procedure has evolved over a period of time so that it includes some amount of liposuction in it, and the new advanced term for it is a lipo-abdominoplasty. I'll explain what that means. So in cases where you've had multiple pregnancies or you've lost a lot of weight, or in general you don't have a good abdominal tone and you have excess skin, the central part of your body will be bulging. This is not just in the front, it is also on the sides where the flanks are. In the front, your muscles, if they are weak, which is what we call as loss of domain, the tummy bulges out along with the skin over it. This skin, when it is stretched, will have stretch marks, and even if you lose weight, the skin may not completely go back. This sort of a body shape is what is ideal for a lipo-abdominoplasty or a tummy tuck. Now, what is exactly done in a tummy tuck? The procedure starts with a cut which is so low that even in a bikini it cannot be seen. Through this cut, we raise up the skin of the tummy, we reach the muscles underneath, and we tighten the muscles and the fascia surrounding it. Now what this does is the muscles which have separated in the midline because of multiple pregnancies and stretching of the abdomen, they are brought together and they are strengthened. So this does not require anything else apart from the muscles being together and stitched up. This gives your core the strength which it needs in order to start your recovery later. And it also helps to flatten your belly to some extent. After this, we pull the skin down, which is in excess, and whatever is the excess left over after the skin is pulled down is removed. So this is what is called as a tummy tuck. Along with that, as I said, we combine liposuction and we also suction the sides to give you a three-dimensional contouring. The earlier procedures used to do just an abdominoplasty, which involved flattening the front of your body. But that ignores the sides, which may have bulges and which may not look natural once the front has been treated. Hence, the procedure has evolved to include a three-dimensional shaping of your torso. So this is the basic procedure and what it entails. Now let's talk a little bit about the recovery. The surgery is a one-day process. You come in the morning, you get admitted, the surgery is done in a few hours, and then you're in the hospital in your room recovering. Usually I prefer to keep patients in the hospital for a day and a half or 2 days because it helps me take care of their discomfort, their pain, and it helps me supervise the initial few hours after their recovery. So once the patient is discharged, typically on day 2, they go home and start their recovery process. Some patients may have a drain in place which is kept basically to remove the extra fluid which may accumulate. This is also removed on day 3 or 4. Patients are given a waterproof dressing so they can have a bath. However, I do recommend that they don't directly enter the shower because water can seep through the dressing, but a traditional bucket and a mug works better in these cases. The usual period for recovery is about 10 to 12 days. I will see you a couple of times in that timeline to make sure your dressing is dry, you're healing well, and the swelling is settling as it should. Another important thing to remember is after a lipo-abdominoplasty, you will be asked to wear a pressure garment. Now this is just like a shaper which people wear under their evening clothes. However, it will be tighter and it will have adjustable hooks or zips so that as you keep shrinking, as your torso keeps coming in, the garment starts shrinking with you. This is very important. The garment is going to be your friend for 2 to 3 months, and please be diligent with it because it's the best way to control the swelling, shape your torso, and give you the perfect waist and midriff that you're looking. A tummy tuck is a very, very satisfying procedure, not just for me as a surgeon, but always for all my patients. Just the amount of skin which is removed and the weight which goes away with the excess fat suction is immensely satisfying for all the patients. Yes, it does involve a cut, but the cut is so low that even in a regular undergarment or a bikini, it cannot be seen. The incisions heal well. The recovery is fairly comfortable, and at the end of your recovery period, which is about 4 to 6 weeks, you have the waist and the midriff which you've always been looking for. In today's world where anesthesia is safe, the recovery is pretty seamless, and with all the products at our disposal for your recovery, tummy tuck is a very safe procedure, especially if you have a large torso or a hanging belly which bothers you. Thank you for watching.